Hello friends, welcome to my YouTube channel Guru Ramdas Educational Society. Today I would like to talk about TB, tuberculosis. Tuberculosis is an infectious disease that is caused by Mycobacterium tuberculosis. It is an ancient disease and since antiquity it has been existed in many populations of different cultures and societies. So coming to the pathogenesis of TB, what in which way does TB infects humans? Before going to it, I would say that TB can be divided into two types, pulmonary TB and extrapulmonary TB. Pulmonary TB means it will involve the lungs and it is more commonly seen in 90% of cases. Now TB, how it infects the lungs, please understand it. Whenever an infected person with TB cough, sneezes, spits, speaks, or sings, it will release respiratory aerosols of 0.5 to 5 micrometer, and these droplets will enter into the lungs of an healthy person and they will come in contact with alveolar macrophages within the lungs. Alveolar macrophages are protective army of our body. So they will protect us from different types of bacteria, viruses, etc. But here in this case, it is protecting against TB bacteria. Now when the alveolar macrophage sees the TB bacteria inside the lung, it will engulf that TB bacteria, and within the cytoplasm of alveolar macrophage there are lysosomes which will release enzymes just like a rifle releasing bullets. So in that way it will release enzymes and those would be acidic in nature. Those would try to kill the TB bacteria within the vesicle that is known as phagolysosome. But due to the unusual structure and chemical composition of TB bacteria, and it contains extra amount of lipids such as mycolic acid, the TB would not die. Rather, it will result in formation of granuloma. Now, what is granuloma? Many alveolar macrophages will come together and they will form an epithelioid giant cell. These giant cells will more closely associate with each other and form a granuloma. On chest X-ray, we can see in the upper portion of a lung a cavity, and this cavity resembles the granuloma. At the center of the granuloma, there will be abnormal cell death, and that is known as necrosis. But this necrosis is very typical because it has a white cheesy material, and that is known as caseous necrosis. So these cavities can also can be incidentally it can be connected by bronchi, and that can cough up the cheesy material. Now this is the mechanism which is responsible for causing TB infection in the lungs. Now what are the classic symptoms in this patient? It can show fever, there can be cough containing mucus. This is known as hemoptysis, that is bloody sputum, and there will be weight loss, cachexia, fatigue, weakness. So these types of symptoms would be evident in TB infection. Now what are the diagnostic tools that can be useful in diagnosing TB infection? So first of all, it is doing cultures, multiple cultures, and along with that we can go for sputum, pus and tissue biopsies. We can go for genetic level diagnostic test like nucleic acid amplification test, adenosine deaminase test. So these specialized investigations are used to detect TB easily. Now in addition to this, we can go for IgRA assays, that is interferon gamma release assays, and with IgRA there will be clear detection of TB because the immune system would not be part of IGRA diagnostic method. Now, IGRA would be more sensitive when it is combined with Mantoux skin test. Now, Mantoux skin test is a tuberculin test which is given where we give a protein derivative of 0.01 ppd into the skin intradermally to see whether there is an induration that indicates an immune response, and on the scale of millimeters we can know if the size is small, it indicates there is no TB. If the size is big, then it indicates that there is TB. There was the BCG vaccine is also used in vaccination of infants and high risk group patients. High risk group patients can be household people, working places where TB is dominant, in people who are in close contacts with TB infected patients. So these are high risk group cases. Now, apart from this, how can we differentiate this infection from other lung respiratory infections? For example, how can we differentiate necrotizing pneumonia from tuberculosis? How can we differentiate histoplasmosis, sarcoidosis, coccidiomycosis? That is based on treatment, diagnostic methods, and treatment. So these three are the basic principles on differential diagnosis. Now, TB can be very violent, it can be over aggressive in patients who have an underlying chronic lung disease like COPD, chronic obstructive lung disease, emphysema, and in addition to this, it can also be seen in genetic hereditary disorders like cystic fibrosis. TB is the second common cause of death after HIV and AIDS, and patients who are HIV positive and who are in stage of AIDS, they can be prone to TB infection, and that is seen in 50% of cases. Now, what is the treatment used against TB? We use anti-tubercular drugs like rifampicin, isoniazid, pyrazimide, ethambutol. So these anti-tubercular drugs are given in combination to reduce TB infection. Suppose if TB is latent means that there are no symptoms but still there is an infection. That is known as latent infection, and it is seen in 95% of cases. There we will give isoniazid only or rifampicin only or combination of isoniazid plus rifampicin, and this is for 3 to 9 months. In new onset TB, we will use combination of 4 antibiotics like rifampicin, isoniazid, pyrazinamide plus ethambutol for first 2 months. In last 4 months, we will use combination of rifampicin plus isoniazid. Now, if a person becomes resistant to isoniazid, we can substitute with ethambutol. So we can give rifampicin plus ethambutol. Now, if there is a recurrent case of TB, we will give sensitive type of antibiotics. We will know which antibiotic can kill TB. We will use that antibiotics for a period of 18 to 24 months. Now, coming to primary resistance and secondary resistance caused by TB different strains. Primary resistance means that the resistant strain of TB is causing infection. It can be any strain. In past, it was believed that Mycobacterium bovis through infected milk was responsible for TB infection. Secondary resistance means that if there is an insufficient treatment administration or inadequate treatment follow-up by the patient, then it can result in secondary resistance. Now I would like to talk about multi-drug resistant TB. What is multi-drug resistant TB? TB shows resistance to first line of drugs, that is rifampicin, isoniazid, pyrazimide, ethambutol. Then it is known as multi-drug resistant TB. If it is extensive drug resistance, it means there will be resistance to second line of antibiotics, and that is known as extensive drug resistance TB. Total drug resistance TB, if there is resistance to all kinds of drugs which are currently used by this bacteria, then it is known as total drug resistance TB. Now, what is the prognosis of TB in patients who have latent infection? The prognosis is good because they will not have any symptoms, we will treat them and they will not be contagious further. In active cases also we will give treatment and we will see that it does not become contagious. So the prognosis is good in patients with latent and new onset infection. But if there is a recurrent TB infection, it can be due to reactivation process in immunosuppressed patients like HIV and AIDS patient, where TB can become opportunistic, and that can result in causing severe TB infections. Now, in patients with silicosis, there is 30 times increased risk for TB infection. Smokers have twice the risk for TB infection than non-smokers. In patients with alcoholism and diabetes mellitus, there is 3 times risk for TB infection. So these risks are basically because of immunocompromised states. In autoimmune conditions which are immunocompromised, there can also be an increased risk for TB infection. Now, what is the stigma that is associated with TB infection? The fear that is associated with TB infection, is that the affected person can transmit TB and that can result in further contagiosity. For this, we can organize TB clubs and promote TB programs, stop partnership programs, and here the TB is more common in developing countries like Indonesia, Bangladesh, Sri Lanka, China, Philippines, etc. So these developing countries have to see that they control the rates of TB. Please subscribe to my channel for more videos. Thank you very much.